Good afternoon and welcome to this community briefing on our ongoing pandemic response efforts. Providing interpretation for us today is Margie Propp. Thank you, Margie. And thanks to everyone for joining us. Let's start with a quick reminder about how we can celebrate safely this holiday season. Number one, get vaccinated or boosted. Wear a mask indoors. Get tested if you have COVID-19 symptoms or have been exposed to someone who has the virus. Stay home and away from others if you're sick, and watch your distance and avoid crowded places and wash your hands frequently. These are actions each of us should be taking to protect ourselves, our loved ones, and our community from COVID-19. Now let's look at the latest data and what it's telling us about our local situation. In looking at the 7-day rolling average of new cases, you can see the sharp increase about a week after the Thanksgiving weekend. From a peak of 182 cases a day on December 5th, we've seen the number of new cases decrease and level off towards the end of last week to 131 on December 24th. We hope this decrease is not temporary, but our experience tells us that we are likely to have another increase in cases and hospitalizations at the end of the year due to the schools being on winter break, families traveling, and an increase in gatherings, plus the arrival of the very contagious Omicron variant. We have seen an increase in demand for testing, and part of this recent increase has included many people getting tested after returning from holiday travel, as well as a number of people from outside of Lancaster County who were possibly visiting for the holidays. With this increase in testing, it was good to see a drop in our positivity rate. It was over 14% the previous 2 weeks and was down to 11.9% for the week ending December 25th. You may have seen reports about long lines at NAMI drive-through testing site at Gateway Mall. In addition to the increase in demand for tests, NAMI had a staffing shortage at the site, and they have increased staffing capacity there today to help alleviate this situation back to their normal routine. We are fortunate to have plenty of testing opportunities across the city. In addition to the drive-through site at Gateway, tests are available at pharmacies, doctor's office, and urgent care clinics. These details are included in our daily updates that you can find at covid19.lincoln.ne.gov. And throughout the pandemic, we've almost always experienced an increase in hospitalization about 7 to 10 days after an increase in cases. We did see an increase in hospitalizations in mid to late December following an increase in cases after Thanksgiving. The 7-day rolling average of COVID-19 patients hospitalized locally increased from 102 on December 11th to 120 on December 19th. Fortunately, we've seen that average drop over the last week down to 113 at the end of last week. Today, our local hospitals report 116 COVID-19 patients with 21 on ventilators. 70 of the patients are Lancaster County residents. And sadly, today we are reporting 2 deaths, 2 men, one in his 70s and one in his 50s, both who were unvaccinated. Our community has lost a total of 23 residents to COVID-19 in December. While we have seen small decreases in cases and positivity rate and hospitalizations, we have not seen a significant change in our local situation. The COVID-19 risk dial will remain in elevated orange for this week. And as you know, orange means that there is a high risk of COVID-19 spread and impact in our community. At our last week's briefing, we shared that we had our first case of Omicron identified in Lancaster County. The original case was related to domestic travel. We now have identified a total of 5 confirmed cases in Lancaster County. At this time, 2 have been related to that domestic travel, along with a household member, and 2 are community spread. Again, this was not unexpected, and we are likely to see many more cases of Omicron in our community. As the new variant continues to spread across Nebraska and across the nation, medical and public health experts agree on 4 key points. First, Omicron cases will increase more rapidly than anything we've experienced in the past. Second, if you're vaccinated, you need a booster dose to protect yourself and others from Omicron. And third, if you're unvaccinated, you're at greater risk. Vaccine is the best protection against hospitalization and death from the virus. And finally, even if you've had COVID-19 in the past, your natural immunity will not protect you from getting infected with Omicron. Getting vaccinated now will greatly reduce your risk of hospitalization and death. The situation again highlights the need for vaccination, and vaccines are a critical tool to provide protection against the virus, slow transmission, and ease the strain on our hospitals and reduce the chance of new variants emerging. Vaccinations are now available for those age 5 and older, and boosters are available for those 16 and older. If you haven't yet received a vaccination or your booster dose, please get it done now. And here's a quick rundown of our latest vaccination stats. 52% of our residents age 16 and older have now received a booster or 3rd dose. 64% of all Lancaster County residents are fully vaccinated, and 22% of children aged 5 through 11 are now fully vaccinated. Vaccination clinics are available at the health department nearly every day. Walk-ins are welcome, or you can go to schedule an appointment at covid19.lincoln.ne.gov. And our local pharmacies are also offering vaccine, and you can find a location near you at vaccines.gov or by texting your zip code to 438-829. As of yesterday, late in the afternoon, the Centers for Disease Control and Prevention updated isolation and quarantine recommendations for the public. The CDC says that the updated recommendations balance what we know about the spread of the virus and protection provided by vaccination and booster doses. Prevention remains the best option. Get vaccinated, get boosted, wear a mask in public, and take a test before you gather. These recommendations can be found at the CDC website, cdc.gov. We are currently reviewing the new recommendations and will be following the updated guidance. We are working with our community partners, including child care centers and schools, on these recommended changes. We have the tools to combat COVID-19: vaccinations, boosters, masking, testing, treatments, distancing, isolating, hand washing, and we continue to call on the community to use them. And with that, we'll take any questions.
Hey Pat, this is Bill with 1011. Thanks for doing this on the week between Christmas and New Year's. I was under the impression that childcare centers are still in Lincoln are still following the old 10-day isolation and quarantine guidelines. Is that not true? Has that guidance been updated?
You know, Bill, we're in the process of updating it with them. And since the guidance just came out late yesterday afternoon, we've been working really hard. We had already set new guidance and been working with all the child care centers, and then this big change came. So what we do is we continue to work with them directly, and they'll be following the same CDC guidance recommendation. We've been working through some different processes with them to be able to keep the children at the center so parents could stay at work and the centers could stay open. So we're just now refining that process and working with them.
Pat, we had a question from the chat. First, what can you tell us about the availability of rapid home tests in COVID? And a related question, for those who turn to the internet to purchase a test, what advice do you have to make sure they're genuine, effective, and they're able to get them at a fair price if they're turning to the internet for their testing?
You know, I know that the availability of tests in Lincoln is sometimes difficult for the home tests to locate them. And we currently are looking at the different types of tests available so that we can provide more guidance and information on our website for the public. So there are more and more coming up all of the time, and you know, people need to be educated about using the home test. If you use a rapid test and you're symptomatic and it comes back negative, this is always confusing, then you should get what's called the PCR test. And that is something that's available at all the testing sites in Lincoln. So for example, people go to NAMI, and at NAMI you can get a rapid test, and that's an antigen test. But if it comes back negative and you're very symptomatic, you should have the PCR test, which they also offer, but that's usually a 24-hour turnaround time on the results. So just a little bit on that. We know that there's a growing market out there. I get emails every day from some places about the availability of rapid tests, and many of them I have to turn away. So that's why we've been looking at what we can do and put more information for consumers on the website.
Pat, this is a similar question about Biden's promise for home testing kits. What can you tell us about that?
You know, we haven't received any direct information. What I do know is supposedly they're going to be available either towards the end of January or possibly the beginning of February, if I read some information correctly. And that's really all I know right now. I don't know the name of the test or anything other than that. And I do know what, as far as pricing, I was going to mention, what I know from people who purchase rapid tests, they're usually anywhere between $23 to $25, just to give people an idea right now what we do know about what they cost.
With the increased demand of testing, is the health department planning on adding any more drive-throughs in the area?
You know, actually, thank you for the question. I spoke with NAMI yesterday and talked with them because they were having a staffing issue, and they've added that. I've also been talking with Bryan Health about where they're at. We are looking at the potential for a short time to be able to offer additional drive-through testing, and probably in the next 48 hours. Yes, it is the most dominant in Lincoln. And you know, our Delta, our Omicron cases in Nebraska are still pretty low. So the feeling is we haven't really seen the surge that is coming. But when we look at what's happened nationally, we know that it's moving this direction. But Delta is definitely the primary variant that we're seeing in Lancaster County at this time.
Pat, this is Bill again. This is a dashboard question. Do you know when booster doses will be included in the vaccine information?
You know, Bill, you always ask me that question on timing. I can't get ahead of you, but we are actually, we've been changing some of the format on the website, and it probably will debut maybe next week or the week after that. They're just fine-tuning that, and the booster doses will be on there.
Will that change who is specifically fully vaccinated? Has that criteria changed? Is fully vaccinated technically 3 doses now?
Well, you know, CDC hasn't officially said that it's 3 doses yet, but we anticipate that will be coming forward.
Thank you.
Kind of piggybacking for that question real quick, Pat. I know I was writing down, I believe you said 52% of people 16 and older are boosted and 64% are fully vaccinated. I'm just wondering what that difference is.
Okay, so the boosted would be those that had a 3rd dose. And fully vaccinated is still the definition that's been apparent: 2 or more doses of Moderna and Pfizer, or a dose of Johnson & Johnson.
Thank you.
Mm-hmm. Okay, with that, I appreciate you being on. We just felt it was important to provide the community an update because of our situations this week. So we'll see you next week again. Be sure and wear your mask and get vaccinated.